Thank you, Mr. Chairman. Good morning, Madam Secretary. I want to pick back up where Dr. Price was. You testified, conceded that you made at least 2 solicitations of donations to Enroll America. Did I hear that correctly?
Yes, sir. And at their request, I made 2 phone calls, yes.
All right. And was there a specific dollar amount that you solicited?
No.
Did you discuss these solicitations with anyone that works for Enroll America before or after you made the phone calls?
Yes.
Who?
I had a discussion with Ann Filippic, who is the director, president of Enroll America.
Was there a specific dollar amount that you solicited?
You just asked me that question. I said no.
Okay. I just want to make sure the answer was the same. Was Enroll America the only entity you solicited funds for?
Yes, sir.
To the best of your knowledge, has anyone on your staff or anyone employed by HHS solicited funds on behalf of Enroll America or any other entity?
I really can't answer that question. I don't know that. Again, there were a very small handful of calls that I made at the request, and 2 involved actual fundraising solicitations, exactly what my predecessors have done, exactly the kind of public-private partnership that we've always anticipated would happen, driving funds not to HHS. I'm not raising money for HHS. I'm raising it for enrollment and outreach activities so Americans can connect with the benefits.
Who were the other phone calls to, Madam Secretary? You said
you
made. Who were the other phone calls to? You said you made other phone calls.
I made a total of 5 phone calls
okay.
for Enroll America, and 3 of them were to discuss the organization and suggest that the entities look at the organization, to Johnson & Johnson, to Ascension Health, and to Kaiser.
Are any of those groups regulated by your department?
Yes, all of them are.
So if healthcare officials say they felt pressured to make donations to Enroll America, your response would be what? That they're just too easily pressured, or that they misunderstood the conversation?
Well, I can't answer what they felt. I can tell you that I felt that the conversations that I had, as I've said in the past, I made fundraising solicitations to 2 groups who are not regulated. I did not discuss funding with the other 3 entities. I did discuss Enroll America. And I would tell you that the statutory authority, Section 1704 in the Public Health Service Act, would not make that distinction. I could legally solicit funds from anybody regulated by our office. I chose not to do that. But promoting a public-private partnership, you bet.
What specific code section are you relying on?
Section 1704 of the Public Health Service Act, which has been in place since 1976.
Is there a legal opinion that you relied upon? Is there someone that
yes, my general counsel's opinion and the precedent of former secretaries. I mean, this is not something we're inventing.
Sometimes precedent is accurate and sometimes it's not. Would you be willing to make that legal opinion available to the committee?
Well, I'll be able to, yes, make whatever, memos are available.
You would make that available to us?
Yes, sir.
Okay.
And I'll also give you the precedent that Secretary Thompson followed, that Secretary Leavitt followed, that was followed during the Clinton administration for the CHIP program. I'm happy to make all of that history available to you.
So if there are published reports that you solicited funds from health care companies, those would be inaccurate?
That's correct.
And if there are published reports that you solicited funds from pharmaceutical companies, those would be inaccurate?
That's correct.
You solicited no funds from any entity that is regulated by HHS?
That is correct.
All right. Whose idea was it to solicit the funds?
I would say it was a joint idea.
Joint among whom?
Well, in the discussions that I had with colleagues and entities interested in actually fully implementing the Health Care Act, it was always recognized from the day the President signed the bill that there would never be enough government funding and that there would not be enough opportunity if this is only a government-run program. So we began 3 years ago to reach out for partners, business partners, healthcare providers, hospitals, health insurers, advocacy groups, disease groups.
Can I get a name? I'm looking for a name. And you said we. Who's we? Did you ever discuss it with anyone at the White House?
I have had discussions with people about Enroll America. Did I discuss it with the White House?
The solicitation of funds to Enroll America?
No, sir.
Never discussed it with anyone at the White House?